Hi everyone, I'm Nika. I took up psychology as my pre-med course and now I'm a second-year anesthesia resident. I chose this field because I loved pharma and physiology back in med school. I took that as a sign that maybe this field is the right path for me. And to be honest, I also like the idea of having my own place in the OR, a place where I can be alone, think, focus, and take care of my patient throughout the surgery. How would I describe residency in 3 words? Extremely exhausting. 2 words pala yun. Exhausting, humbling, and fulfilling all at the same time. So in the hospital where I work, we follow a pre-duty, duty, and from duty cycle. During our pre-duty, our day starts quite early, usually at 7 a.m. But we are expected to be at the hospital earlier than that. Mga 1 hour to 30 minutes before the start of our cases para makapag-prepare kami. We get assigned to both operating room and non-operating room cases. Like, for example, endoscopies, colonoscopies, ERCP, and also sedation for diagnostic procedures like MRI, PET scan, cerebral and coronary angiogram. We also sometimes do sedation for procedures like bone marrow aspiration biopsy. We also do intrathecal chemotherapy for cancer patients, among others. So we get to handle different cases. Throughout the day, we would do pre-op evaluation of our patients. Usually, pag inpatient yung case, there's already a pre-op evaluation done the day before. But if it's an outpatient case, we would do a quick pre-op before the case when the patient arrives and then refer our cases to our consultants. And then when the surgery starts, we administer the anesthesia. We monitor our patients throughout the surgery and manage any issue that comes up, whether it's hemodynamic instability, blood loss, or airway concerns. We are expected to be knowledgeable and skilled at handling these situations. During duty naman, the flow is basically the same, but we get assigned to the more challenging and the longer cases kasi kami din yung magsistay sa hospital until the late hours of the day. And then the duty does not end when the regular OR schedule is over because we stay overnight. And then if there are any urgent cases that would come in throughout the night, we are expected to cover these cases as well. Following day, we stay in the hospital and continue working until all of our assigned cases are finished, which is usually around 5 p.m. Sometimes earlier if we are lucky. And then once all of the cases are covered, we can finally go home. But before that, we do pre-operative evaluation for our patients scheduled for the next day. And then after that, we get to go home, finally get some rest. And then the following day, we would return to the hospital at 7 a.m. for our pre-duty, and then we start the cycle all over again. So on a duty cycle, I'm typically in the hospital from around 7 a.m. to 5 p.m. the following day. But of course, it's different per institution and it depends on the workload and when all of the cases are completed. For me, the hardest part of residency is definitely balancing the demands of training with the responsibility of caring for patients. So residency kasi, the learning curve is very steep. You're expected to learn so many things within a relatively short period of time. And at the same time, you are also sleep deprived. You're tired. You're just running on caffeine most of the time. and sometimes you don't even have enough time to sit for a proper meal. Wala kang time to take care of yourself. And paano ka nga naman makakapag-alaga ng ibang tao kung yung mismong sarili mo hindi mo maalagaan ng maayos? So, for me, that was the challenging part. You're expected to always be alert and be at the top of your game, but how can you do that if you are exhausted? Eventually, when you get to gain mastery of your tasks, it becomes easier kasi mas bumibilis ka na, and then mas nagiging madali yung work. The work does not get easier, but you become more adept, you become more skilled at handling the tasks. So, mas may time ka na for yourself when you get to that point. Isa pang malaking challenge is yung idea na ang dami mong hindi alam. When you start your residency training, mahirap to for people like me na ang taas ng expectation sa sarili. For those na mataas yung standards for themselves, it's gonna be a difficult ride. Kasi pagdating mo dito sa residency, ang dami mo talagang hindi alam. It's very humbling. And it keeps you on the ground because every day there's just so much to learn. So what is the most rewarding part of residency? For me, it is seeing my growth over time and knowing that I am making a real difference in my patient's care. Moments when a surgical case goes smoothly without any problems because of the skills I have developed throughout my training, and knowing that my patient feels safe and is comfortable under my care. All of these things make all the hard work worth it. My advice to pre-med students is to stay curious, work hard, and to be patient with yourself. Give yourself enough time in deciding if this is really for you, because medicine is a lifelong journey. Para naman sa mga aspiring anesthesiologists, if you are really considering ANES, then you must build a strong foundation in pharmacology and physiology. Learn to stay calm under pressure. It's a skill that I am trying to master until now, and pay attention to the small details because they matter. Anesthesiology is a field that requires vigilance, a lot of preparation, and teamwork. But it's also incredibly rewarding. So if you're considering ANES as your future practice, you're in for a challenging, exciting, wonderful learning journey.